It's my great pleasure that I'm given this opportunity to speak to all of you on a very important topic of suicide behavior seen amongst students. Before we really think about what can be done to prevent this behavior and number of deaths occurring due to suicide, it's important to understand who are these students, what is their nature, behavior, and problems who attempt suicide. Generally, generally these students are facing a number of challenges and pressures from psychological field. The, the stress can arise from within because of a conflict, because of the internal pressure of feeling competitiveness, feeling less than what they are not being able to look at themselves with the same self-esteem as they should, because probably they have not been trained for this. We all need to be told how to consider ourselves worthy. What is good in us, somebody has to really tell us, be it members in the family, or our friends, or the teachers in the school, or anybody else. Once we understand that it is important to live, find out what is an individual's reason for living. Still, some people feel pressure from their families, from the studies. Some develop mental health issues like depression, alcoholism, severe anxiety, and some others develop a personality which has number of behavioral traits like impulsivity. They are by nature very hurried people, have very low threshold for stress tolerance, or have very shallow emotional stability. These are the candidates who are vulnerable and may succumb to transient pressure and think about giving up their life. So before we plan what can be done, we have to know what might be the reason behind somebody's possible suicide attempt. Let me also be very specifically tell that there are no blanket approach. There is no single approach which will be suitable for everybody. For every single person, the approach for intervention will be very different. However, when we think about preventive strategies, that can be tailored to one individual or one student, trying to reduce the risk factors, the causes, and deal with those conditions which have been found responsible for suicidal ideas, and to develop a system for a group of people. For example, develop policies and programs and see that how program is implemented. So there are two different kind of approach, individual approach and an approach towards a group or a society or a social group or a small group. For example, it can be every college may have a different policy. Every university may find different things working suitably for their students. So we have to be ready to have multi-pronged approach and number of approaches rather than one single approach. So when we suppose we prepare a list of what things can be done, what approach can be taken. Now, there are a number of things which have to be done by the student or the client himself. There are certain things which can be done only by their friends. There are certain things which can be done only by parents, and there are certain things which can be done only by the school organizations and the teachers. Nobody can do somebody else's intervention. However, it is important that everybody remains involved in this important mission. It is a mission, it is a life-saving intervention that you are going to offer when you want to plan and see what works or what does not work. So if we put everything together, we may begin by saying that the first intervention required is appropriate mental health information, because it is the mental health information and knowledge that will allow a student to think whether he has problem or is he developing a nature of symptom. So in order to identify presence of a symptom, in order to find out whether an alert should be given or not, whether seriousness of his thoughts and ideas are reasonable enough, a good set of mental health information is important. And that is why I repeatedly say that information about mental health needs to be written on the first page of curriculum books, because there is nothing more important than this chapter, which will allow you to explore yourself, which will allow you to tell you who you are, how to find out whether you are good, you are functioning, or you are not functioning, whether you are, if you are not sleeping, is it a normal pattern or is it an abnormal pattern, whom to go, whom to see, and whom to talk to. And so a valid, credible, important information about mental health of student is the need of the hour. The curriculum must contain a booklet with information on mental health. And then it is also important that once students join the university or college, they are given some orientation as to how to talk, how to express, how to deal with their stress, how to develop interpersonal relationship, how to establish communication, whom to talk to when you feel stress, what are the logical difficulties. And I see a number of good programs being conducted in number of medical colleges, engineering colleges, and many institutions which were not there before in India. And it's a happy turn, which is the institutions are becoming aware, but it is not enough. We need to do thousands times more than what we are doing. It's not enough. Students are crying, they are feeling pressure, and they don't know what to do, where to go, what not to do, how to avert the desperate action that they tend to develop. They don't know whom to confide to, how to develop a trustworthy relationship. So once you receive students in the institution, it is incumbent on the institution to sit together with these students and try to address the issue of behavioral psychology. The most important thing to succeed is to know what is the pathway to success and what happens after you succeed and what happens if you do not succeed. It is important to be prepared from all possible angles. These are important information, and we will continue this conversation.